talk a little bit about venous disease, give you a basic understanding. Veins, as you know, are what returns blood to the heart, so they're flowing from your legs, they're flowing up towards your heart. What keeps them going in that direction are valves in the legs. Every few inches there's valves that keep the blood flowing up and won't let gravity pull it right back down. There's deep veins and there's superficial veins. The superficial veins also have valves that keep them going up, but importantly, flowing into the deep system. The difference between the deep and the superficial are under the skin and the deep are in the muscle. They're completely surrounded by muscles, so that as you walk and move, you actually squeeze these veins and pump the blood up, and the valves keep it going the right direction. That generates pressure in the deep veins. The superficial veins do not have pressure, so the valves stop it from going out to the superficial veins. What causes varicose veins is superficial venous insufficiency, or the failure of these valves. So what happens is, as your muscles are squeezing these deep veins, you're pushing the blood up, but now it can go out, and that causes pressure to go to these superficial veins. Those, as more valves fail, blood can flow backwards. Gravity can start pulling it down too, so you get a combination of pressure coming from the deep veins and pressure coming from the pull of gravity. And what that does to the superficial veins, which are normally very small, flat veins, they now are under pressure. They become large veins and poke out from the skin. So you start to notice them poking out from the skin. That pressure inside those veins can cause some discomfort. Veins are also normally fairly straight, so when they're under that kind of pressure, they start to stretch out lengthwise too, so that's why they end up looking like this. So if you look at these veins, they're very tortuous. They're like little bubbles poking out from the skin, and that can cause some discomfort. It can also cause poor flow in these veins. As you can imagine, blood's not going to flow as well through these big dilated tortuous veins as it is through small superficial veins. Blood that doesn't flow well we call stasis, and it can cause clots. Now these clots will form in these varicose veins, and they will turn hard, get inflamed, red, very painful, but they're not generally the kind of clots that travel and kill you like we worry about so much. They do increase your risk of those kinds of clots, but you don't have to worry about that as much. Obviously you'd want to be checked if you had something like that. The next thing starts to occur if a lot of blood's flowing backwards. That blood that goes backwards now has to get back into the deep veins and find another way up and go back. They may go back up the same way they went. Well, that means these veins are working twice as hard. They can even start to dilate, even dilate so bad that their valves stop working. But basically what happens, if there's too much blood getting back down and going back up, then you notice swelling around the ankles. So you'll start to swell around the ankles. So here's a foot. You'll notice swelling around your ankles. That usually occurs towards the end of the day. Now, one of the characteristics of this kind of swelling is that there is a treatment. Get your legs up, and if it does, then the swelling should go down. So in general, what I ask my patients, when you wake up in the morning, do you have ankles? And by the end of the day, are they gone? Yeah, they're all swollen, you don't even see them anymore. That's very characteristic of venous swelling. Most of the other kinds of swelling you won't go away just from elevation. So they may improve with elevation, but they don't go away. So the swelling is something that we really don't like, because if you allow that swelling to continue, you start damaging the skin, and usually it starts off with a little bit of redness and itching down here, and then eventually turns all brown because you're actually staining the skin with the iron from the blood that's leaked out of the vessels from the pressure. And eventually you can get sores down here, and that can cause a lot of problems because they're very difficult to heal. Treatment of the venous disease can stop that swelling. But that skin damage, once that damage is done, it's there. You'll stop it from getting worse. But if it's already at the point that you have a lot of damage, it's going to remain even after treatment. One of the treatments, of course, that your insurance company is going to require is stockings. By by compressing down against these bulgy veins, they can help with that discomfort, and they're very tight around your ankles, and they can help prevent that swelling. So generally speaking, they do effectively treat the symptoms. They will help your swelling. They will help your throbbing pain that you get from the varicose veins. I have a hard time getting patients to wear them here in Florida because they are quite warm, but they should work. Now, in order for the insurance company to pay for any kind of treatment, you have to try those stockings, and then you have to come back and say, well, this isn't working, or particularly if you continue to get swelling despite those tight stockings. Now, most of the time they do work, so but they do at least help prevent the throbbing discomfort. But many times it will not control the swelling, and you'll continue to get the damage to the skin if the condition's bad enough. Now, treatment's a very large subject because it depends on what we find.